So medCrowd is a compliant messaging technology for health and care teams. We know that many health and care workers are using non-compliant technology like WhatsApp, Facebook groups, even iMessage and SMS to send information, clinical information to each other at work. And they're doing this because the NHS provides them with archaic tech like pagers and fax machines. And so they're using these amazing things in their pockets, their smartphones, to use the messaging apps they've got to send each other information. The problem is that's not compliant with NHS regulations, NHS requirements, and it's probably not compliant with the UK data protection law. So medCrowd is better for two reasons. The first is it's compliant. So if you look at the consumer messaging technologies like WhatsApp, Facebook, etc., they're not compliant. So people should not be sharing confidential patient data there, or even partially anonymized data that could become identifiable if you add up bits of data, the date of birth, the condition, the location, the doctor's name, and a combination of factors could make that patient identifiable. And the second reason is very clear, that almost every messaging app we know works by sending messages to a group, just like WhatsApp works. So you get a never-ending stream of group messages. So you can imagine you talk about patient A, talk about what you're doing on the weekend, talk about patient B, you share a funny joke, and all of that information is just in one big long stream. So what medCrowd does is you send a message to a conversation, and then you can have a conversation about patient A, a conversation about patient B, a conversation about funny jokes, and a conversation about what you're doing on the weekend. Which means you can pick out that conversation about patient A and you can drop it into the patient notes, and you can collect all the information about that patient together in one place. And that's a fundamental difference in the way that it works, and that's really important to health and care teams, so they can sync those conversations back into the notes so that it's in the proper care record of that patient. For us, it's a really broad definition. We're thinking about all health and care workers all over the world being able to use it. It could be a doctor working in the NHS. It could be a nurse who's working for Lambeth CCG. It could be a paediatrician at Everleigh London Hospital, Children's Hospital. It could be somebody working in Zambia, potentially. And we've got lots of these conversations going on, and we're very excited about the potential for all of these people to be involved in using it. So I worked 5 years clinically before leaving to do this, and in my time there I got very frustrated with the kind of organisational restrictions on health and care workers. I fundamentally believe the NHS is fantastic because of the people who work in it. Yet when I was working there, we were constantly being kind of tripped up by the systems. The way we were set up, it was extremely difficult to work in that environment. So I'm kind of passionate about sorting that out. But what I want to do is deliver an amazing technology that actually has a genuine impact on hundreds of thousands of health and care workers' lives, so they can do their job better, more efficiently, and give better care.